All right, guys, week 2 of Operation Go Green in October. We're not going to go pink this year. We're going to go green. We're going to talk about preventing problems rather than trying to deal with something that might sneak up on us. So today, what I want to talk about is mammograms versus thermography. Am I telling you not to get a mammogram? I am not telling you not to get a mammogram. I just want to tell you the differences between mammogram. And I'm actually going to talk to you about ultrasound and MRI also, because those are two other studies that can be done. So let's talk about the risks and benefits and disadvantages of each one of those. Number one, with mammogram, there's ionizing radiation. This is why you don't get mammograms very often, is because there's radiation there. It's like getting a chest x-ray kind of thing in sensitive tissue. And number two, compression. Everybody knows that getting in and getting the mammogram is not the favorite activity of any woman who does get a mammogram. The benefits of a mammography is fatty breasts. You can actually see some small calcifications or tumors in using mammography. So that is a good benefit of getting one maybe yearly. Disadvantages, if you do have dense breasts, and 40 to 50% of women do have very dense breast tissue, you can't see very much. Sometimes you'll miss things. And actually there is up to a 25% false negative also rate in mammography. So there might be something there that you can't see because of the density of the tissues. So let's talk about ultrasound. Ultrasound uses sound waves and a gel to actually see what's going on at the cellular level. So benefits are you can tell if there's a solid mass there or if it's just a cyst. And so the ultrasound is less invasive, not many risks to having an ultrasound done. But it does only find a tumor. It doesn't actually find anything that may be brewing that could become a tumor. MRI, there's not many risks to an MRI. It's using magnetic fields to find soft tissue issues in the body. Now, if you do have any metal in your body, you know, such as screws or pins or anything from surgeries, or even shrapnel, if you know, people who have been shot maybe have little pieces of metal, then an MRI is really not the best way to go. There is no radiation, however, it's pretty expensive, so it is cost prohibitive. You know, we're talking $1,100 or so to get an MRI. And you can, since it is so sensitive, you might find false positives. You might find things in there that really aren't tumors, and it could be something that you then have to go have other studies done. So thermography. Thermography, I think, is the best of all worlds. There's absolutely no risk involved, nothing, because it's like taking a picture. And you can see changes before a tumor actually comes about. So when, as I've talked about before, when cells start to divide rapidly, the increased blood flow creates heat. And so that's what we're looking for. There's no compression, there's no radiation. It's simply checking heat, the temperature of your skin at the skin level. So it can't actually pinpoint a tumor, and actually none of these are diagnostic. With mammography, ultrasound, MRI, thermography, none of these are going to say there's cancer right there. All of these are going to say there's something in there that we need to take a further look at. And so with thermography, if we see some heat changes, then what we'll do is say, okay, go get an ultrasound or maybe a biopsy, and depending on the pattern that is seen. So less than a 3% false negative rate, but yeah, you can't exactly pinpoint an actual tumor with the thermography. We're actually trying to prevent tumors from forming. So that's the comparison in all the studies that we're using. What I like about the thermography, as I've said before, and I'll keep on saying, and I want you to understand, is that we're going to be able to find something before it becomes a huge problem. Mammography has its place to find something that is kind of a problem. Thermography, we're going to look even before then, sometimes 7 to 10 years before a tumor would begin, and let's maybe make some changes and be able to prevent it from becoming a tumor. So as we go through this video series, I'm going to be talking about maybe a few changes that you can make, but with the thermography, you do get a consultation on lifestyle changes that can help, and that's what I really want to promote in October. Let's talk about health of the breast. Let's not talk about cancer of the breast. We know about that. How can we be healthy and prevent this cancer thing? So stay tuned, and we'll see you next week.